Welcome to the training session about lead in construction. Today we are going to talk about lead exposure in your workplace. You have the right and the responsibility to know about the hazards of lead and the proper procedures for protecting yourself and coworkers from exposure or harm. We'll discuss lead in your work areas, how to identify lead hazards, and how to protect yourself from those hazards. The objective of this training session is to protect your health and keep you productive. At the end of the training session, you will be able to understand lead hazards, exposure and control, respiratory protection, medical surveillance, information about chelating agents, engineering controls and work practices, your right to access medical and air sampling records, as well as a copy of OSHA lead standard for construction. Lead overexposure is a leading cause of workplace illness. The health hazards of lead exposure are well documented. Even a one-time exposure to extremely high levels of lead can have immediate serious health effects. However, in most workplaces containing lead, the more likely health hazard is the result of long-term exposure to low levels of lead. If you are exposed to lead at or above the action level, an airborne concentration of lead of 30 micrograms per cubic meter of air, OSHA's standards require that we train you in a number of topics, including health hazards of lead, operations that could result in exposure, restricted areas, engineering controls, medical surveillance, personal protective equipment, PPE, hygiene and housekeeping, and decontamination procedures.
Lead is really bad for your health if it gets into your body. Here are some of the health effects it can cause: anxiety, headache, tiredness or insomnia, loss of appetite and stomach pain, numbness, pain, weakness or twitching in your muscles, reduced sex drive, sterility and birth defects. Men and women of childbearing age should be especially careful about their exposure to lead. Lead can affect men by causing impotence, reducing sperm count or sterility. Lead is especially harmful to the fetus in a pregnant woman. Kidney damage, permanent brain and nerve damage. Children are very susceptible to the effects of lead. Smaller amounts of lead can harm children than can harm adults. It is important not to take any lead dust home on your clothing. Just a little bit of dust can spread around your house where children can be exposed. There is no real safe amount of lead, but there are levels that cannot be legally exceeded. OSHA says you cannot be exposed to lead limits of more than 50 micrograms per cubic meter of air. 50 micrograms per cubic meter is a tiny amount in the air. As a comparison, think of a single drop of oil in a 55-gallon drum of water. Lead is not hazardous if it can't get into your body. However, in construction, there are several ways lead can get into your body.
In order for lead to enter the body, it must be in the form of a dust or fumes. Lead cannot go through your skin. You can inhale lead spray paint or lead dust from such jobs as sandblasting, grinding, sanding, sawing, or cutting on structures containing lead paint or other lead products or coatings. You can inhale lead fumes from welding or burning lead paint. Lead can also get into your body by swallowing lead dust on your hands when eating, drinking, or smoking. Some jobs where you could be exposed to lead are cutting or removing lead pipe in old buildings, grinding or sandblasting lead paint on metal structures, using solder that contains lead, bridge painting, remodeling old buildings with lead paint, cleaning up demolition sites with lead dust.
We will provide you with appropriate protective clothing and equipment to protect against any lead hazards you may be exposed to on your job. This may include coveralls to protect your body and underclothing from contamination, gloves to protect your hands from contamination, hats or hoods to keep lead out of your hair and ears, work shoes or shoe covers to prevent lead from contaminating your shoes, face shields or goggles to protect your eyes when wearing a half-mask respirator. A respirator if the amount of lead dust in the air exceeds the legal limit. Respirators must be worn when engineering controls, such as ventilation, or administrative controls, such as job rotation, are not enough to reduce lead exposure below the PEL. Before you can wear a respirator, you need to have it properly fitted to ensure that it does not leak. You must have a medical evaluation before you can wear a respirator, because respirators can cause stress to the body, especially if you have heart or lung problems. We will also train you on the use, limitations, and care of respirators.
The best way to remove dust from your protective clothing is with a HEPA vacuum. The lead dust is drawn into the vacuum and contained. Do not remove lead dust by blowing with compressed air or by shaking your clothing. This only spreads the lead dust around and puts it into the air where you will breathe it. Dispose of lead-contaminated clothing in sealed bags or containers. If you reuse your work clothing, keep it separate from personal clothing to prevent cross-contamination. Use disposal or laundry containers labeled Danger, clothing and equipment contaminated with lead. May damage fertility or the unborn child. Causes damage to the central nervous system. Do not eat, drink, or smoke when handling. Do not remove dust by blowing or shaking. Dispose of lead-contaminated wash water in accordance with applicable local, state, or federal regulations. Work areas with lead concentrations greater than 50 micrograms per cubic meter are designated as restricted. Signs are posted stating, "Warning, lead work area, poison, no smoking or eating." If you work in an area with lead concentrations greater than 50 micrograms per cubic meter, you must wear respiratory equipment in order to reduce the exposure below the PEL. Showers, changing rooms, and lunchrooms are provided for workers exposed to airborne lead above the PEL. Do you have any questions regarding lead hazards, exposure, and control? Do you need to go back and review any information?
If you are exposed at or above the action level for lead, which is a concentration of 30 micrograms of lead per cubic meter of air, averaged over an 8-hour day, you must have your blood tested. If the lead in your blood is above 40 micrograms per deciliter, you will be provided with a medical exam. If you are exposed to lead for 30 or more days a year, you will have your blood tested routinely. If you work in an area containing 30 micrograms of lead per cubic meter of air, you will be given a medical exam before starting your job. If you report possible symptoms of overexposure, you will be offered a free medical exam. If you want medical advice regarding personal lead exposure and the ability to have a healthy child, we will provide that advice. You will be removed from a job with lead exposure at or above the action level if blood lead levels average at or above 50 micrograms per 100 grams of whole blood in a series of tests, and use of engineering controls, such as protective clothing and respirators, cannot bring lead exposure down, or a medical exam places you at increased risk of material impairment of health due to lead exposure. If removed, you will keep your pay level, seniority, and benefits. Blood must be tested monthly during removal from the job as a result of lead exposure. You can return to your job when blood test results are less than 40 micrograms for 2 consecutive tests. The amount of lead absorbed in body tissue may be reduced by a drug therapy called chelation. There may be side effects. Chelation is permitted only under a doctor's supervision to reduce blood lead levels for symptoms of lead exposure or to diagnose lead poisoning. Chelation to prevent elevated blood levels or to routinely lower blood lead levels without symptoms is prohibited.
Never take food, beverages, or tobacco into areas with high lead levels, as they may spread contamination even if consumed in a different area. When you leave the high lead area, vacuum contaminated clothing or remove and dispose of it. Wash before eating, smoking, or applying cosmetics. Don't go home wearing lead-contaminated clothing. At the end of the shift, remove your contaminated clothing, leave it in the changing room, shower, and put on clean personal clothing. Store work clothes and personal clothes in separate areas. When working in a lead area, always use your assigned respirator. Use water when sanding, grinding, or cutting objects that contain lead. Use vacuums with HEPA filters to clean floors and other surfaces. Do not use compressed air. Do not shovel, brush, or use dry sweeping.
Stay out of restricted areas unless you are authorized to be there. Obey warning signs. Signs should state, "Warning, lead work area, poison, no smoking or eating." Open doors and windows or use a fan that blows outdoors. At outdoor construction sites, large fans can blow dust away from the workers. Ventilation is one common protection against overexposure to airborne lead. Mechanical systems may be used with enclosures or containment situations. Remember, lead cannot be vented outside one work area to another area. Lead dust and fumes must be captured in some type of collection system. Local portable ventilation systems can be installed next to specific tasks, such as welding or sanding operations. Shrouded power tools with ventilation can be used to capture the lead dust that is created while grinding, sanding, etc. Measure the ventilation system's effectiveness every 3 months. Ways to measure ventilation systems include measuring capture velocity, duct velocity, or static pressure.
OSHA requires air monitoring of employee exposure if there are any indications of dangerous lead levels, such as an employee with symptoms that could indicate lead exposure in the work area. If monitoring indicates exposure above the PEL, monitoring must be repeated every 3 months. If initial monitoring indicates exposure between the action level and the PEL, monitoring must be repeated at least every 6 months. If monitoring shows lead concentrations below the action level, no further monitoring is required unless there are changes in the workplace. Whenever any changes in the work area could lead to new or added exposure to lead, OSHA requires us to conduct monitoring again. We must inform you in writing about the lead levels revealed during monitoring in your work area, including any action taken or planned to reduce dangerous lead exposures. You may observe any air monitoring. Air monitoring includes personal monitoring for full shifts in order to get an accurate picture of lead exposure. You can ask to see your medical records related to lead. Blood sample results will be given to you. You also have the right to a copy of OSHA's lead standard for construction.
Learn the job tasks that risk lead exposure. Know the symptoms of lead exposure. Use ventilation. Always wear your respirator. Follow hygiene practices.